quick overview of Swine Health Information Center. First of all, the concept of the Swine Health Information Center is preparedness, response. And there's two issues here: preparedness to regulatory diseases. There's preparedness to non-regulatory, other transboundary diseases. Swine Health Information Center focuses on those non-regulatory transboundary diseases rather than the regulatory FMDs, the classical FADs that are under the command and control of USDA should they come into the country. It's one of the things that we learned from all of the experience over the decades of having some sort of a centralized industry ability to respond to diseases that are not of regulatory interest. We haven't had that before, and this is our first go-around at trying to form that. So the Swine Health Information Center, coordinated disease monitoring, targeted research, and analysis of data. And all that is around the health of the U.S. swine herd. So it's focused on the health of the U.S. swine herd in looking over the hill, in targeted research efforts, and in analyzing data to help improve the health of the pigs out on the farm today. This is a group effort within the center. There have been two working groups formed. One is a Preparedness and Response Working Group. A big number of people are working in preparedness and response and helping from a variety of different expertise areas. And that's the strength of the center and what we're trying to get done. Preparedness and response and the monitoring and analysis working group. Without the input of these experts and these people that have a interest and a stake in the pork industry, we wouldn't be able to do the work that we're doing, nor get done what we've done. As an example of one of the things that has happened, Senecavirus Seneca A outbreak from last year, increase in incidence in 2015, a very marked increase in incidence that we weren't able to predict, but it happened very quickly over the summer. And the center was able to put just south of $400,000 into research to help identify distribution, the movements, what's different, the analysis of the virus itself, cleaning up. All of these things that you see on the right side of this slide are all of the things that we focused on in trying to give as quick of information as we could out to producers and veterinarians about how to manage and how to approach a disease that we hadn't had before, and at that level. And I will also point out that on this slide there is some USDA contribution in this too. This isn't just a center issue, and you saw on those working groups that we have all of the collaboration we have. It's university collaboration, it's private industry collaboration, and it's collaboration with USDA. And so they have also helped in that response, and it's very much appreciated. The 2016 plan of work is organized within those working groups in preparedness, response, monitoring, and analysis. Just to highlight a few things that we're going to be doing in 2016 for the preparedness group. Diagnostic development, we will be putting approximately $1 million into research into being able to identify viruses or pathogens should they be introduced into the U.S. So the first effort here in preparedness is to be able to find something new, and part of that preparedness is to not have to develop the PCR or the nucleic acid detection or whatever manner it is. When we get it, let's have it ahead of time. And so we'll be putting efforts into making that happen in 2016. There's also a project that was done by Dr. Scott D. with the Pipestone Group and South Dakota State that looked at the rate of inactivation of PED virus in various feed commodities. So soybean meal, different vitamins, different amino acids, and whole feed. We are importing those products from China, and one of the things that we want to know is their rate of degradation as they're shipped. And so Dr. D's already published that. What we're going to do, one of the projects we're going to do in 16 is we're going to take our list of viruses and start working down the list to find out the rate of inactivation or the rate of degradation for those viruses to help identify risks. I think if you could put a theme around 2016 and what the center's trying to get done in 2016, it's to help to identify risks so we can be better able to respond. And in that response, one of our things that we're working on right now is setting up an infrastructure across the country for the ability to quickly to respond to diseases, to outbreaks, and that includes the formation of rapid response teams in various in areas around the country, not national, but in regional sections around the country, both for events of unknown etiology and also for events that we know the etiology, the outbreak. Coordinate within 24 hours, be able to be out on the farm within 72 hours, all with the invite, of course, the invite and the cooperation of the producer, the state animal health officials, and as we go. Another issue for response is the 2016 planning for, hopefully we don't have to use it, but planning for another thing to come in or something else to happen similar to Seneca Valley in 2015 and being able to respond to that. So there's money within that, within the budget to be able to respond. Diagnostic support in emerging disease discovery. That goes along with the rapid response teams. If we don't have an identified etiology for an outbreak, the center is going to help in that case to subsidize the diagnostic fees for further investigation into those cases. So hopefully we can come to some conclusion for an etiology. There have been cases historically and continue of outbreaks of clinical signs, clinical disease in pigs. The producer and the veterinarian follow them up to a spot where it's economically, the economic ability to follow them up to that spot. But then after that, if there isn't the interest, if there isn't the economics to be able to support it, it doesn't happen. And so one of the things that the center wants to do is to help in those cases to try to reach an etiology so we can be better informed about outbreaks and what's going on around the country. Within monitoring, the matrix, our list of diseases that we have, list of swine pathogens that we have on the y-axis with the diagnostic tests on the x-axis. We're continually, that's a living document. We're continually reviewing that. Within that working group of monitoring and analysis on that working group are people that volunteered to participate, and they were asked because of their ties that they have to other countries and production in other countries to be able to update our risks again through our matrix as we work with that. That is not just a simple thing of let's just look for all of the viruses and let's try to figure out if we have diagnostics, but it's also an effort to put some structure and some regularity around the identification. So there's USDA efforts, there's private industry efforts, private company efforts, and then pork industry efforts, the center efforts into developing this network to help to monitor for diseases. In analysis, one of the big things that we're doing this year, or that we're helping to support this year, and we're looking forward to see if USDA will cooperate and collaborate on some funding for a project to standardize the coding for swine diagnostics within diagnostic labs. Those codes have all been developed according to the different diagnostic labs, their needs, and how they've been built. And that has led to the diagnostic labs not being able to share information quickly because of the different codes and the different ways that those were developed. If we're going to be able to analyze, if we're going to be able to respond, we have to be able to quickly share information. And that quick share of information is not supported by having different coding methods in each different diagnostic lab, because they all have to be interpreted then before something can happen. So a big project for this year is to help with that standardization of coding coming out of the diagnostic labs. The center has a website, swinehealth.org. The plan of work, the research that's been done, the updates on all of the research, the updates on the matrix and the disease monitoring is all on the swinehealth.org website, so there's a lot more information about it there.